everybody, this is Dr. John Hayes. You're listening to Beating Neuropathy and Chronic Pain on 95.9 WATD. Welcome everybody. This of course is Sunday evening, and once again I have the distinct privilege and honor of having in the studio with me Lara Amaral. Lara, welcome back.
Hey John, thanks for having me back in. It's a privilege. Thank you.
Of course. You know, one of the biggest questions I got after the last show was, who is this lady? How can I get in touch with her? So we don't make that mistake again this time. I want you to tell everybody how they can learn more about what you do.
Yeah, okay, great, and I appreciate that. So, easiest way to reach out to me is via authenticallywellness.com, and it's authentically you, Y-O-U, I should say. And right on there is that health history form that we talked about in our last segment. And again, it's complimentary. It's a great way to review your symptomatologies, your health history. We go over your genetics, your ancestry, your blood type, any issues that you're having. And think about it. When was the last time you go to the doctor and you get to spend an hour with a health practitioner? And that's really what it's about. So we do it for your listeners. I'm offering it as a complimentary consultation. They can grab the health history form right there on the website, and then it'll email directly to me.
Awesome.
Yeah.
Awesome. Thanks so much for doing that. You know, I do want to make sure we set the stage here a little bit, because this is really important. We were talking last week about the relationship between food and illness, of course, sugar and illness, metabolic syndrome, which seems to be a recurring theme on this show because it is that important. We spoke about the relationship between what we eat, how we live, how we think, if you will, on our biochemistry, how we burn fuel, how we control our blood sugar levels or fail to control our blood sugar levels. All of these things have a profound effect, ladies and gentlemen, on how you feel. Right. It has such a powerful effect on chronic aches and pains. Mm-hmm. Chronic pain, you know, as a generic term, probably has as its root inflammation, as we spoke about, you know, at some length. So that is the reason that I've invited you, you know, to spend this time with us, because I feel so strongly about what you do. But more than that, I feel very, very honored to watch you do what you do and how you've been able to do it, because you have brought something to the table that, you know, myself is trained in more of like a classic nutrition and more classic academics just don't always do. So. Right. If somebody was to come and see you, what would happen? Let's say somebody came to you because they had a health issue. Take us through that whole process, if you would.
Well, yeah, so really, and to your point, like, how is it working for our country as a nation, counting carbs, fats, sugars, you know, calories? It's not working. Right. So how it works with me is we sit down, we review your entire health history, we go over your concerns too. What is your body currently telling you? And what I look for, and more often than not, John, to your point, is, you know, when I start hearing I'm hungry all the time, I just keep eating. I don't know what's wrong with me. And I just eat and eat and eat. Like, once I start going, I can't shut it off. In the evenings, I just keep eating. And literally, that is going to your point with regards to metabolic resistance or insulin resistance. What happens is one's homeostasis is thrown off. It's off kilter. That's all it is. So hormones are not working properly. There's a ghrelin hormone and there's a leptin hormone. And when those are not working efficiently, your brain and your stomach essentially are not communicating effectively. So what happens is the individual keeps eating and eating and eating. That's another symptomatology, John, without having to go and get fancy blood work and labs, without having to wait to take action. That individual, I know, is suffering from metabolic resistance syndrome. And it's the beautiful thing is that your liver, your pancreas, super forgiving. It's very easy to reverse it. So I don't want to be a downer, you know, but it's life-threatening, and it's putting that individual on a trajectory that's you know, extremely dangerous. They're going on the path of diabetes and cancer and heart disease. So what I do is sort of provide them with the tools You know, and we put together a personalized program that's going to help get them reversing their symptoms. And it really is a lot easier than one would think, and it's just a matter of, you know, looking at that individual and figuring out what they're exactly doing. So it takes time for me to diagnose and work with them as their health practitioner to figure out what are they doing exactly today so that we can turn it around and get their body working effectively and efficiently. But you know, a lot of people think it's about willpower, and I just want to say, like, you know, they might go to their doctor and the doctor says, well, you got to lose some weight and then you'll be better. Or, you know, or I'll meet with an individual and it's, you know, their husband or their wife or their parent will say, well, if you would just lose weight, your woes would be gone. And it's not. I just want to highlight for your audience, for your listeners, that it's really not all about willpower. That we now know also that there is a switch in our brains, and that with people that are more on the obese side, that they lack a neurotransmitter called dopamine. So they actually require more sugar to hit that neurotransmitter. So they are going to eat more and more and more. So in other words, that individual, it isn't about willpower. It's about how do they eliminate the sugar in what they're consuming, which isn't, you know, they're not setting out to take 46 teaspoons of sugar into their bodies, which I think we're going to talk a little bit more about this in today's program. But I just want to let your listeners know it's not all about willpower.
Right. You know, you raise several different points that are really important, and I think we probably want to, you know, back up and hit on those. You know, we talked about, as you so eloquently say, it's not about willpower. You know, but a lot of it, that doesn't mean that a lot of our health is not behavioral and a lot of it's not within our control. That's not what we're saying. But I think so much of it in our society now is, you know, not taking care of ourselves as we should, and you know, not taking care of those key lifestyle components that make it, you know, such a big difference in why we behave the way that we do, and why, you know, as we were talking about earlier, when some people get really stressed, they eat tremendously, and this has been proven in laboratory animals as well as human beings. Some people eat huge volumes of food, and some people shut down. Some people don't eat, they don't drink, and you know, either way, you're going to make yourself very sick. And it does have to do with the hormone system of you know, leptin and ghrelin and so on and so forth. So with that said, when we come back from the break, we're going to delve much more into this very fascinating area. You're listening to Beating Neuropathy and Chronic Pain on 95.9 WATD.